Uh, Hello everyone. My name is Tuan, and this next one to me is Leilani. We are team two working on a project called Patience Health Navigator app. For a couple of months, we're working together as a team, and today we want to say something about our story.
Thank you for that introduction, Tuan. So, hi, I'm Leilani, and Tuan and I want to tell the story of how we started developing the Patience app, which is an app to help Americans navigate their healthcare. We started out this project with nothing but a strong desire to help people navigate their healthcare, help people understand their healthcare better, and at the beginning, we really didn't know where to start. The healthcare system in the US is just such a complex system, and there are so many problems within it. But with the support and engagement of our communities, we learned what tools people needed and what people needed help with. And honestly, we became completely obsessed with the problems surrounding surprise medical bills and how to help people avoid them and fight them. And so, through telling the story, we also want to explore the journey of what it's like to really fall in love with a passion project like this as a disabled developer. That's me. So, we hope to raise awareness and empower others who are also disabled in tech by showing how it can be different to work on a passion project like this as a disabled developer. And we'll tell this story both through my firsthand experience and the struggles that I had, the obstacles that I had to overcome, and ultimately my achievements in this project. But we'll also look at it from my teammate and partner Tuan's point of view, and how he was able to support me through the project. And we'll explore how able bodied people can support their disabled teammates. Thank you.
Yeah. So at the beginning, I didn't know that my friend Lenny, she has chronic migraine would affect her every day. At the beginning, I didn't know anything of that. We have some tasks, we have schedule meeting quickly, but she it took her quite more times to finish the task than I expected, and sometimes she soon felt ill and she couldn't join the meeting. So, but like after all of that, I she was straightforward with me about herself, and I realized that my friend he is really special to the team. She's very hardworking, really passionate about the project, take her time to do the work, but she pay lots of attention to every details of the app. She perfect on it, and I admire her, and I'm grateful for her to be part of this team. There was a lot of obstacles in our part, the difficulties in both understanding the problem we're solving and even in technical side. So I think I'm gonna leave the rest to Leonie to tell to like let everyone know about yourself and how we are here. What is the obstacle in the project? What's in your obstacle in the project you are working on?
Yeah, so I would say my biggest obstacle really is just the chronic pain, and the way that that manifests is really the way that it affects my schedule, because I have pain every day, every single day, but sometimes it's not too bad. Like right now, I can talk, I can work, I can do everything a normal person can. But sometimes it's really bad and I can't do anything for days on end, hours on end. And it just hits me out of nowhere, and I have no way to control when that's going to happen, where that's going to happen. And so that basically leaves me unable to stick to schedules. And so I would say that is probably the biggest obstacle, with deadlines and trying to manage, time management and stuff like that. It's really difficult to work around a disability like this. So that's probably the biggest obstacle.
Yeah. And how does it affect you and in the project in the whole? And how do you overcome it?
Yeah, so I think as a whole, as it affects the project, it definitely just it makes it so that it takes me longer to develop features for the app. For instance, to just get things done, basically, it just takes me longer because a certain percentage of my time is spent in pain when I can't work. That's just how it is. But at the same time, sometimes I do have really, really good stretches of time where I can work, a lot in a couple days, and so sometimes I can get a lot done, and that can be really, really fun, and where the passion is when I can just sit down and work on it for a really long time.
When I working with you, I noticed that sometimes like you are in pain and you still decide to continue working, even you are in you are in constantly in pain.
Yeah.
And I saw that you just work in the dark room, just you and the computer. So how do you feel about that?
Yeah, thank you. That's a really good question. There's it's really hard being disabled. There's just sometimes there's no easy answer, unfortunately, and sometimes I've had migraines that last 10 days straight. And sometimes there's just no escaping it. And it gets to the point where I start to get used to it a little bit, or you know, but sometimes I'm not getting used to it, and it's really bad. But I can just work through the pain, and it's not fun, but yeah, I just do that because of my passion for the project, and it's kind of just one of those things that I think anyone who has experienced chronic pain can probably relate to is, you know, when it's there all the time, you just learn how to live with it. And it's not fun, but it's kind of what you have to do sometimes. And so it's unfortunate, but it is kind of just reality. Yeah.
Yeah, and that's why I think you are stronger than anyone else. You work harder than anyone else, and yeah, that's why I feel grateful to have you on the team.
Thank you. I appreciate that so much. And yeah, I think it's just like it's these trade-offs that we make as as disabled people, especially with chronic pain, is like you you push yourself to your limit, until you can't anymore, and then you can let yourself rest, kind of. And it's unfortunate that we have to do that, but um, sometimes there's no other option, and I think that's why it's so important to talk about these things, um, just so that people understand, and understand how it is from the perspective of someone with chronic pain, so that they don't think like, oh, you must be faking it since you can work sometimes when you're in pain, but other times you can't. It's just like, it's that personal decision that you're making, that like, okay, this deadline I really have to meet. And sometimes, like for school, for example, it's like, okay, if I'm going to fail this class, I'm just going to work really hard, even if I'm in pain, just to pass. And so, yeah, thank you for that question because that's a really important thing to talk about.
And what is your personal message to other people like you, disability in tech?
Yeah, thank you. That's the one that I'm the most excited about answering. Yeah, yeah, it's been such a journey for me to really realize these things and internalize them. So I don't take them lightly. Like, it's really important. Um, and the first thing, I think the most important thing is, listen to yourself and try to prioritize your health whenever you can. Like the discussion we were just having about, sometimes you push yourself because you have to meet a deadline, or you really can't fail this class, or there's a financial reason why you have to push through the pain, or do something because of your disability. But whenever you can, prioritize your health because that's the most important thing. Um, and then also just, especially in computer science, like really try not to compare yourself to others. Try not to compare yourself to other developers, programmers who are able bodied, who don't have chronic pain, who aren't disabled, because it's just unfair to yourself. It's like comparing apples and oranges. It's just two different things. You have your struggles. I'm sure that person has their own struggles. Um, and, it's okay to work slower. It doesn't mean you're stupid. It really doesn't. It just means that you have different obstacles that you have to overcome every day to get your work done. And, sometimes it just takes me, twice as long looking at a line of code to be like, oh, that's the problem. But it's because I'm like trying to overcome the pain in my head. Like, it's totally okay. So just try to be kind to yourself. Really, I know how hard it is to not compare yourself to others, but really try not to. Um, this one's more of a technical thing, but um, I think that like the advice of like being modular about development and really breaking down your work into small pieces is that has really helped me, and being like organized with my work and making sure that I'm testing along the way and not biting off more than I can chew. Those things have really helped make the process easier for me, because when you have small amounts of work that you can do, you can get up and leave and go rest and like take care of yourself and then come back and look at your last commit and say, okay, that's what I got done, and like pick up where you left off in a way that makes sense, instead of trying to like untangle all the things you were doing. So that has actually really helped me as well. Yeah, I think that's all I can think of right now. But yeah, the most important thing is just don't compare yourself to others. You are you. You have your own struggles, and just try to be kind to yourself.
Yeah, like I learned from you that I shouldn't judge anyone because we don't know what the battle they are dealing with every day.
Yeah,
So
exactly.
be, be kind and be nice to everyone.
Yeah.
Development should be helping people, helping community.
Yeah. You know, this project really showcases our passion for this project.
People who are affected by the U.S. healthcare system.
Yeah. This project really showcases our passion for just trying to help people learn and empower themselves with knowledge and data about their own healthcare and their health insurance. And we want to tell the story of how we built this app with our community support. We reached out to our friends and family and strangers, other students, people who have experienced surprise medical bills, people who have been financially hurt by the healthcare system. And, we worked with them throughout our whole journey of developing the app. We reached out to mentors in the healthcare field to help us develop the app. So, you know, there's a lot we want to say in this story.
Uh, yeah, like if anyone interested in our story, you know where to reach us.
Yeah, absolutely. Thank you so much for listening to our TED Talk. Um, yeah.
See you next time.